Outbreak in the United States is now considered the largest in 25 years. The CDC released its weekly report today saying there have now been more than 700 confirmed cases. News 5's Olivia Fecto spoke with a doctor at Cleveland Clinic today about how you can stay safe.
Good evening, Frank. According to the CDC's report, more than 70% of the 704 people with confirmed measles were not vaccinated. Doctors say vaccination is key to making sure the disease doesn't come to Ohio.
This is going to be one of the worst years, and it's not even half over yet.
The CDC is calling this the largest outbreak in the U.S. since 1994. Dr. Frank Esper is an infectious disease specialist with the Cleveland Clinic and says although measles was declared eradicated in the U.S. in 2000, there are still several hundred cases each year.
Because we keep getting these from outside the United States, we remain at risk.
There have been 704 confirmed cases so far in 2019, and doctors expect that number to rise. While no cases have been reported in Ohio, Ohio's vaccination rate for MMR is in the bottom 25% in the country.
Now, not all of those people, are not vaccinated because they want to be. All right. Some of those people who are not vaccinated is because they can't be. They have medical conditions, or they're allergic to the vaccine, or they're too young to get the vaccine.
The best way to protect yourself and others is to get vaccinated if you're able.
But the reason it's not 7,000, the reason it's not 70,000 is because of everybody else who's gotten vaccinated.
People born between when the vaccine came out in the 1960s and 1989 may have had only one dose of the MMR vaccine. That's 93% effective, but a booster pushes that up to 97 or 98%. 90% of people must be vaccinated to have herd immunity and prevent outbreaks because measles is so infectious.
It's something that stays in the air. After you've coughed, after you've sneezed, it floats in the air for up to a couple hours, so that you can leave the room, but someone else comes in an hour later, they can get infected from you being in that area.
The vaccine, doctors say, can minimize the number of cases that lead to pneumonia or brain swelling. And that doctor told us the measles vaccine is so effective. If you are exposed to measles and are not vaccinated, you can still get the vaccine for up to a day or so after that to prevent measles from taking root. Olivia Fecto, News 5.